top 5 concerns that you might have leading up to your birth and the reasons why we have these concerns. So for me, I find that in any time when we are addressing fears when we're preparing for labor, it's super important to understand that these fears are validated. You're allowed to feel anxious about them. And as well with that though, the way that we address our fears is with understanding why these situations might happen so that we can cope better with the discomforts of them happening at all. So these top 5 fears will be pooping in labor, tearing during labor, any type of cord issues, the possibility of needing a cesarean, and the 5th one being the unknown and just not knowing what to expect. So like I mentioned, super important to understand why it is that pooping even happens in the first place in order to be able to address the concern and hopefully be able to kind of be desensitized to the idea of it before the big day. So the reason we poop when we're in labor is because when the baby is descending the birth canal and pushes down on the colon, it is sending messages to our brain because the baby's head is pushing down on the same muscles that would be pushed down on when a bowel movement is coming. So our brain associates it with we need to poop, and that is why we do it. Often before pre-labor symptoms are actually having loose bowel movements or having to have bowel movements as the body is preparing for birth. So you don't have to worry. It's not normally a large amount. It's normally just bits and pieces that are left because our body normally kind of releases everything on its own before labor even starts or even during labor and before the pushing phase. So it kind of works as a natural enema. Second concern is tearing, and the reason that this happens often is because of pushing. It's not because the baby's head is too big. That's a huge misconception. So if we are preparing for labor beforehand and doing good perineal massage and stretches, so look into like your prenatal education to figure out what that is. And there's even equipment such as like things called epinose, and if you get something like that, then this is something that can help to get used to stretching, getting used to that sensation so that you can help to prevent large amounts of tearing later on when you're in your labor and you're pushing. So it's not because of labor, but it's because you're pushing that causes the tearing. So also making sure you're listening to your doctor's cues. If your doctor is asking you to go slow, even if you're feeling like, I don't want to go slow, I want to go faster, I want to get this out, it's important to listen to the cues because that helps to give the perineum enough time to stretch instead of it being so quick and more traumatic for your body. So the third issue is often with anxiety around the cord. So about 20 to 30% of deliveries, the cord actually is around baby's neck when the baby is delivered. This is considered normal and it's not something that often has to be of a concern. Yes, the cord helps to deliver oxygen to the baby. So the idea of it being wrapped around its neck is concerning because you don't want the baby to be deprived of oxygen. However, your cord is so lubricated that it's very lubricated, it's very loose. It's not something that often is super tight like a noose, okay? So people think about wrapped around the neck, they think, oh my goodness, they're not gonna be able to breathe. That's not often the case. Most often after the baby's head is delivered, your provider will say, okay, I want you to stop pushing for a second. And that's often just to loosen up the cord, to release it from around the baby's neck so that when you push that there is no oxygen deprivation and so that everything is fine. So you do not need to be as concerned when you're thinking about the cord and with baby being wrapped around baby's neck. Next concern would be, what if I need to have a C-section? So the biggest thing that you can do when you are addressing the fear of needing a C-section is to be prepared for it. What would happen in my hospital if this was the case that would happen? What are things that I can do in order to make this an empowering experience for me? What are the protocols? What are the procedures? What things are important to me in the vaginal delivery? So like skin to skin, is that something that I can translate into the OR later? You know, things like that. Addressing why medical emergencies might need it and then just being prepared for that. Because if it's not medically necessary, then if you are getting your proper prenatal education and you are able to advocate for yourself, then it's less likely that you will need an unnecessary cesarean. And the last thing is the fears of the unknown. So the best way to address this is with proper prenatal education, making sure that you know every little step of the way. And like, I know that might sound like really overwhelming, but it's important to know. And you can just even start with interventions. What interventions might be used at all? So with looking at inducing labor and looking at pain management and looking at like heart rates and heart dips, what's normal, what isn't, understanding medical language and being able to understand, like if the doctor says the baby is too high up and we need to administer Pitocin, what does that look like? What does that mean? birth has a bunch of curveballs that might be thrown your way, and the best way to combat those is just with proper education, having a good support system, and having somebody that is on your birthing team that will advocate with you in terms of what you want. And again, as I've mentioned before, and I love it, it's the abbreviation of BRAIN, you know? So with everything, when you are doing your prenatal education, you are looking at the benefits of everything. You are looking at the risks with everything. You are looking at the alternative measures with anything. You are looking at what your intuition tells you with any situation, and you're looking at what would happen if we didn't do anything about any of it. Okay, so use your brain, be prepared, and be prepared to advocate for yourself. If you're looking for more coaching, I offer that through my services at thenurturedjourney.com.